What is Andermann syndrome? Andermann syndrome is a genetic disorder that causes motor and sensory neuropathy. Damage to motor and sensory nerves makes it difficult to execute various movements and to detect sensation throughout the body. A copy of a mutated SLC12A6 gene is inherited from one's parents. The newborn is then affected by the mutated gene. The corpus callosum is the structure that connects and sends crucial information between the left and right hemispheres of the brain. Without it, it is extremely difficult for the two halves of the brain to communicate. Andermann syndrome is often associated with agenesis or malformation of the corpus callosum. Agenesis is the complete or partial absence of this structure. There is a very high prevalence of Andermann syndrome in the northeastern regions of Quebec, Canada. Andermann syndrome affects both males and females of the French-Canadian population in the Saguenay-Lac-Saint-Jean and Charlevoix areas. Andermann syndrome was discovered by Ava and Fred Andermann. Ava traced the mutated gene back to a couple who married in Quebec, Canada in 1637. Every 1 in 23 people of the French-Canadian population in the Saguenay-Lac-Saint-Jean and Charlevoix areas are carriers of the SLC12A6 gene. Out of this area, Andermann syndrome is extremely rare in other parts of the world. Parents of a child that has Andermann syndrome both carry the mutated gene but show no symptoms or signs of the disorder. If the parents do not know they are carriers and conceive a child, that child will have a 25% chance of having Andermann syndrome, a 50% chance of being a carrier that shows no symptoms, or a 25% chance of not having the disorder and not being a carrier. In the Saguenay-Lac-Saint-Jean and Charlevoix areas, every 1 in 2,000 babies are born with Andermann syndrome. People who suffer from the disorder typically only live until their mid to late 30s. Since Andermann syndrome is inherited, there are not any lifestyle or medical risk factors that would cause Andermann syndrome. The SLC12A6 gene is responsible for making the potassium chloride cotransporter, a protein. This protein is responsible for transporting ions of potassium and chloride across the cell membrane. This transportation is important because these ions need to be moved together to ensure that the electrical or chemical gradients remain neutral. The potassium chloride cotransporter is highly related to the development and care of the nerves. A malfunction of the cotransporter, which is caused by a mutated SLC12A6 gene, makes it difficult for the corpus callosum to develop properly, and since the nerves are unable to be upkept, motor and sensory functions do not occur. People born with Andermann syndrome usually don't start walking until they are 3 or 4 years old. Once they enter their teens, they typically lose the ability to walk. Other than sensory and motor neuropathy, people with Andermann syndrome exhibit the signs of hyporeflexia, which is absent or normal reflexes. They also exhibit the signs of hypotonia, which is weak muscle tone. One of the main symptoms of Andermann syndrome is a weakening and eventual loss of sensation in the limbs. From this, contractures, a deformity of the joints due to a change in tissue type, and mild to severe scoliosis develop as a person with Andermann syndrome ages. If cranial nerves are damaged, facial muscles will also weaken. Ptosis, which is drooping of the eyelids, will occur, and people may also suffer from gaze palsy, difficulty tracking movements with the eye. People with Andermann syndrome also suffer from intellectual disabilities, seizures, and psychiatric symptoms such as anxiety, agitation, depression, hallucinations, or paranoia. If a person, usually a child, and especially if they are from the French Canadian population, shows the signs or symptoms of Andermann syndrome, they should get a neurological examination as soon as possible. Children of parents who carry the mutated gene should also undergo a neuro exam. An MRI would be performed and the corpus callosum would be examined to check for abnormalities. An examiner would also electrically stimulate the nerves to test the sensory motor pathways. If there is an abnormal or absent response to sural, ulnar, or median nerve stimulation, it could indicate sensory motor neuropathy. This usually occurs during a child's first year of life. If there is a family history of Andermann syndrome, a person should have a gene sequence analysis performed. This can help diagnose and assist in determining if a person is a carrier of the mutated SLC12A6 gene or have the disorder. As of right now, Andermann syndrome is not curable or treatable because it is a genetic disorder that is inherited. There is no current research or clinical trials being conducted to find a cure for Andermann syndrome at this time. It is a progressive genetic disorder that gets worse over time because it is very unlikely that the corpus callosum, nerves, and the sensory motor pathway will regenerate. As the nerves in the brain and body continue to die, the body's sensory motor function will diminish. There are strategies to help manage the comorbidities of the disorder, but nothing to actually stop the disorder from progressing. People with Andermann syndrome will have an initial assessment. They should be evaluated on their development of age-related skills to see if they lack meeting fundamental milestones, like walking. They should also have a physical therapy assessment to evaluate how strong their muscles are and to see if they can execute skills that allow them to be self-sufficient. They should be monitored for psychiatric episodes as they enter their adolescent years. They should meet with a psychiatrist to diagnose these episodes and discuss options for treatment. After the initial assessment, a treatment plan can be created by a team of specialists consisting of a physician, physical therapist, psychiatrist, or orthopedist, or anyone else who may be involved because of a comorbidity. People with Andermann syndrome have a difficult time walking and moving. Walking aids such as walkers and canes are required to assist them in locomotion. If and when the adolescent develops mild to severe psychotic episodes, neuroleptics, a type of psychiatric medication, is prescribed to help manage the psychotic conditions such as anxiety, agitation, depression, hallucinations, or paranoia. Physical therapy is needed for the upper and/or lower limbs to help prevent and manage contractures. People may also develop scoliosis, and corrective surgery is sometimes required to help straighten the spine. In order to prevent Andermann syndrome from becoming a more serious issue in the Saguenay-Lac-Saint-Jean and Charlevoix areas, or even other regions around the world, researchers have recommended various steps people can take to not spread or pass the mutated SLC12A6 gene. Especially if a person is part of the French-Canadian population, they should get tested to see if they are carriers of the mutated gene. If two adults are planning on conceiving a child, it is highly recommended that they get tested for the gene, find out their status, and speak with a physician about prenatal testing and options before pregnancy. It is also highly advised that people with Andermann syndrome do not reproduce because their offspring will inherit the disorder. Research has also shown that a sibling of a person with Andermann syndrome should also get their genes tested because they have a 50% chance of being a carrier.